Hi, my name is Anaya, and I'll be teaching you the proper way to do nail and foot care for your patient. So you want to first do proper hand hygiene. Once you have done the proper hand hygiene, you want to go ahead and provide privacy for the patient. And the next step you want to is introduce yourself to the patient and greet them in a nice manner. You want to make sure the patient knows what you'll be doing today. You want to go ahead and gather a little bit of information. Before, you want to identify the patient with their name and birthday and check their bracelet. You want to make sure that you gather some information before taking care of the patient. You want to know the water temperature, if the patient has diabetes, if you want to know the person is able to assist themselves, what kind of method you'll be doing, and all things like that. It is important when doing nail care and foot care to know if your patient has diabetes. If your patient has diabetes, you cannot perform this task. Only an RN could take care of that. As a CNA, you are not able to, but you should check your care plan and things like that to know what your role is and what you could do at your limit. So I introduced myself, now I'm getting to the point. So you want to go ahead and tell your patient that you'll be giving them proper hand care. You want to get them in the proper position so my patient is able to assist themselves and help and sit up. So I'll be helping my patient sit up in a proper position like that. You want to get your table, and of course, in this case, I don't have a table, so I'll pretend I have a table right here. You want to go ahead and explain anything that you'll be doing to the patient. You want to let them know that you'll be soaking their hands, you'll be cutting the fingernails, cleaning the fingernails, things like that. So you want to go ahead and put on your gloves, and also you want to make sure you know what to report and what to observe on your patient and when to report it. You want to make sure you see any things like redness, swelling, loose nails, ingrown nails, things like that. So once you put your gloves on, make sure you have your equipment ready. You'll need like a basin. In this case, I'm using a bowl. I don't have the exact equipment. And your nail clipper and everything the agency provides you for the nail care. And the correct method as well. So you want to go ahead and take a brief look at your patient's nails, fingers. Make sure there's no ingrowns, any loose nails, cuts like that. Let the patient know what you're doing as well. Make them feel comfortable. Frequently ask the patient, are you fine? Are you okay? Making sure they're comfortable. My patient's hands are fine. So make sure to check the temperature water that you'll be soaking your patient's hands in. You can also let the patient feel the water, and if any preference is made, then you could fix the water. So in this case, you'll put it on top of the over table. I don't have one, so I'll be using a bowl. So then you'll use your basin with the water and let your both hands soak. So you'll have like the proper tray for it. But so let's say my patient's nails are soaking right here. You let the nails soak for about 15 or 20 minutes. Make sure it's 15 to 20 minutes because that's the proper time for the water to remove dead skin cells and bacteria from the fingers. So once the hands are soaked, you want to go ahead and see the patient's nail. You want to look at the fingers, and you want to remove any dirt or debris from the nail with the orange stick. In this case, I don't have one, so I'll be using the nail clipper as an example. So you want to go ahead and go gently. Remember to be very gentle with the patient and let them know what you are going to do. Go under the nail to remove any debris or dirt from the nails. Do every nail carefully. You do the same procedure to the other hand under the nail. making sure that your patient is not in pain and comfortable. Let them know that they could tell you if they're in pain at any moment, because you want to make sure to not hurt your patient. So once you have done that, you want to go ahead and push the cuticle back with the orange stick, because it's a proper equipment. In this case, I'm using this as an example. So you want to push the cuticles back. You'll then grab like a sponge that the agency would give you, and you want to slightly dampen the water, and you want to scrub the nails to remove excess dirt and to also remove dead skin from the cuticle. You want to do this to both hands. Make sure to tell the patient what you're doing, and also, again, ask them, are they okay? Are they fine? Are they comfortable? Are they in pain? Once you have done that, you want to grab it. If you see that their nails need to be trimmed, in some agencies, they don't allow you to trim nails, but let's say you check your agency and it's your responsibility to trim the nails. You want to trim the nails straight. You want to follow the circular part of the nail. Make sure to always cut straight. Never cut on the sides or below the skin. You want to cut right in a straight form. So you want to cut straight for every nail. Keep in mind to do this carefully, slowly. Take your time. Don't rush through it, because you do not want to hurt the patient or accidentally cut them. So once you have properly trimmed the nails, you want to go ahead and grab a towel, and you want to dry the hands. Make sure to dry the hands really well in between the fingers as well. Once you have dried the hands, you want to check your care plan, and you want to ask your patient, do they want any lotion on the hands? So let's say your patient wants a lotion. And also, if it's safe, you want to check the care plan or ask the RN if it's safe to put any lotion on your patient's hands. So you'll grab some lotion, lather it up on the hands, give them a brief massage, make your patient feel comfortable and relaxed. This should be a relaxing moment for your patient. It promotes circulation as well. A brief massage. Once you have done that, you want to go ahead. Now we're going to dispose the gloves, and we are going to go now to the foot care. So in this case, I have a mannequin. So let's say my patient's feet should be kind of dangling from a chair or the bed. You want to, once again, do proper hand hygiene care. Let's say now I have my gloves here. Remember to have your equipment by you ready as well. And you also need to gather information, just how I gathered information for my patients' nail care. You need to do it as well for the foot care. You have to make sure they don't have like diabetes. You have to make sure that they that you are the one that will be cutting their nails or not, because in certain agencies, CNA is not allowed to cut the nails. If they have diabetes, you may not cut the nails. You cannot soak their feet either. You need to let the RN do that, or whoever the agency requires them to trim the nails. So once you gather the right information and the right products that you'll use on the patient and the right equipment, you want to get started. Let your patient know what you'll be doing. Let the patient know that they could tell you at any moment if they feel uncomfortable. So check the water temperature as well. Like I said, make sure your patient is okay with the water temperature. You want to make the patient feel comfortable. So if they need any like foot support right here, you could put a pillow or something, making sure to feel they're comfortable. So now you grab your warm water and you will let the patient's feet soak in the water. Let them know you're putting the feet in the water, and you ask them, is the water okay? Does it feel okay? Are you comfortable? Then you want to let the patient's foot soak for about 15 to 20 minutes. Once the 15 to 20 minutes have gone by, you want to go ahead and tell your patient, you want to let them know that you'll be putting a towel under their feet. So you want to slowly and carefully move foot outwards and place the towel right under their feet. Then you want to go ahead and grab an orange stick as well. I'll pretend this is my orange stick. And you want to get rid of any dirt or debris on the nail. Carefully go under the nail, but make sure to do this slowly and carefully. You do not want to make your patient feel comfortable or in pain. Let them know if it feels fine. Once you have done that, you could grab a sponge or a scrub with the soap and water, and you want to scrub on the toenail area, making sure to get any debris or dirt out. Then you want to scrub the rest of the foot. Once you have done that, once you have scrubbed it, you want to make sure that the patient is feeling comfortable and okay. You want to go ahead and remove the towel. You want grab another towel. In this case, you'll have a towel under still, but I'm using the same towel for my example. So you will want to dry the toes. You want to make sure, this is the most important part, you are very drying the entire feet area, and you dry in between the toes as well to prevent any odor or infection like that. Because if you let the patient with their feet wet and they put on their non-skid socks on, it could cause odor, infections, things like that, fungus. So you want to make sure and dry the foot correctly. Once you have completely dried the feet, you want to use any lotion and make sure it's moisturized, and give your patient a proper brief massage, making them feel comfortable and relaxed. Make sure to go in between the toes as well. Do the same for the other foot, and make sure to tell your patient what you're doing and that are they feeling comfortable with what you're doing. Once you have done that, you want to go ahead and assist your patient with putting on non-skid socks. So in this case, I don't have some, but I'll pretend I'm putting some. You wanna like roll the sock all the way and make sure you put it on the feet. Once you have put the patient's socks on, you want to help them back into a comfortable position. Rearrange anything for them in the room. You want to make sure to dispose the gloves and do hand hygiene once again. Then you want to make the patient feel comfortable, relaxed. Ask them, do they need anything else? Can you assist them with something? Ask the patient, are they comfortable? Do they need maybe a book or something? And then that is it. Thank you.